8:55. We're here for the Mississippi Medical Association and Mississippi Food Network's food drive. Just a quick follow-up to the prior segment. Want to make sure I got this right and pass it on. Laura Bush did ring the bell to close out the New York Stock Exchange session Monday, September 18th, 2006. That is interesting, and it was the president who actually visited on January 31st, 2007. He just made a surprise visit. Well, we're pleased to welcome now Dr. Dan Edney, the State Health Officer with the Mississippi Department of Health. Dr. Edney, thanks for joining us today.
Thank you, Gerard. Always glad to visit with y'all. Thanks for the invitation.
Absolutely. So what do you think about this food drive? How important is this in the state of Mississippi? It apparently it appears that many of our citizens are somewhat underfed and need food, need nutrition.
Yes, I'm real excited for this event. It will be impactful as money is raised and food is collected for our state food banks, who do a wonderful job all around the state. So many communities do have local food banks that really do plug that gap for food insecurity for local populations. But this is a really big issue nationally and extremely important in Mississippi as we lead the nation in food insecurity. And then also the whole topic of food as medicine is a big public health subject now, where you and I had visited recently about how important primary prevention is, health education, behavior modification for all of us, so that we learn to be healthy and how to stay healthy, so that we don't lapse into chronic disease illness. And food insecurity, food as medicine, really is at the foundation of that. Unfortunately, our food insecurity rates are running about 16%. That means 16% of households in the state have too often the struggle of not knowing where their next nutritious meal is going to come from, or if they're going to have enough calories in a day to feed the family. And I think about my own life, and, all food insecurity means for me is, am I going to have enough time to eat lunch today? But for too many Mississippians, especially children, too many of our folks don't know if they're going to have enough calories in the day. We have too many children in Mississippi who do go to bed hungry, even though we have great programs to try to supplement feeding through the SNAP program and the WIC program. But with a poverty rate of 19.6% for the whole state, it just drives the whole bus. And this event, among so many other programs, does help chip away at that problem.
Yeah, it's really astounding when you think about the data and just where we stand in 2024, that we still have so many people, so many households in our state that are struggling just with nutrition and just the daily necessary caloric intake to sustain their lives. I'm just shocked by that.
Yeah, and then being a very rural state, we also have the issue of food deserts, which means that we have counties where there are no supermarkets. We have folks that live in rural Mississippi that are having to depend on small convenience stores to access food, and even though they may have SNAP benefits, the stores that are available to them aren't selling nutritious food, so they're buying really high calorie, low nutritional value food. So that it's not just getting enough calories, it's getting the right calories. If most of your calorie is sugar and bread, carbohydrates, then it's going to lead to an unhealthy lifestyle. And you combine that with being more sedentary as a people as we've become, then it just complicates the issue. So I'm real proud of the health department that our areas that really focus on health promotion and preventive health are leaning in to the food insecurity issue. The health department, we have the Delta Health Collaborative, and the Delta, which is no surprise, has the highest burden of food insecurity, followed by Southwest Mississippi. But Delta Health Collaborative is doing similar work to what y'all are doing today in terms of increasing access to nutritious food for folks in the 18 core Delta counties, working with community partners every way we can, using community health workers to navigate families, to utilize resources that are available that they just don't know about. A big thing of the Delta that we're doing is really promoting local farmers markets, and also looking, the SNAP benefits being available at farmers markets where there's healthy fruits and vegetables. We're looking at pilot projects with WIC, doing likewise. Our Women and Children's nutritional program is a whole lot more than just formula with WIC. It's nutritious food for women and their children. Just looking at innovative ways to connect impoverished Mississippians and areas of food deserts in rural Mississippi with nutritious food. I want to point something out to you. When you're driving around the state, you do a lot of that like I do. Look out for those DG market stores that are opening up out in the middle of nowhere, which have supermarkets supplying rural Mississippi. I was so proud to hear the governor announce that the chicken industry is making a huge donation of chicken and eggs to the food banks. I'm just really pleased that at this time of year where we're focusing on our blessings, that a lot of folks are trying to look out for the least of these who just don't have the same access to nutritious food that you and I have.
Yes, really, really incredible. So the Mississippi Medical Association, in conjunction with the Mississippi Food Network, has this drive going on. It's been going on all season, but in particular, they're calling attention to it today. It's important, is it not, Dr. Edney, that we just not rely on government and government policy and government handouts to address this problem, but that we engage the private sector and just private individuals to help out?
Absolutely, Gerard. I mean, I'm no government stooge, but even though I'm the agency head of the government agency, there's no way we can do what we do in public health without public-private partnerships. And the State Medical Association leaning into this issue, I think, is critically important. Pulling together private industry like y'all are doing, SuperTalk being a big part of that, but the other corporate sponsors, we can do so much together than we can do alone in terms of government or private industry alone, but bringing our resources together really are force multipliers. And the event y'all are doing today is magnificent. I really commend the Medical Association that the physicians of Mississippi care about this issue of food insecurity. I think it's really forward-thinking that they are doing that and that y'all are partnering together to make things better.
And how much, Dr. Edney, I know when we last visited, you talked about the economic, the financial cost of just poor health and, more importantly, just premature death in our state. How much does this food insecurity contribute to that overall problem?
It does a great deal, Gerard. I was reflecting on that this morning. That $25 billion a year negative impact the economy that you and I were talking about. As we chip away at food insecurity and help our folks, especially our children, young people, young adults, understand at the beginning of life how to have nutritious diets that, if you have access to the food, if you take advantage of it, and you just have a healthy, nutritious diet with just reasonable physical activity, you're gonna avoid a lot of the death and disease that we're encountering as a society in Mississippi. And that $25 billion starts to get smaller and smaller. So, the investments being made on events like today, they have a huge ROI. And as we look at programs such as connecting with farmers markets and food deserts, looking at big food distributors, like Walmart and others who are looking at using drones to deliver groceries in rural areas.
Wow!
I mean, some really amazing stuff that's going on. I'm optimistic that this problem will get better, and that we as Mississippi will get healthier.
Dr. Edney, always appreciate you joining us, sir. We got to go, but always appreciative of your efforts to help make Mississippi healthier. Thanks a lot.
Thank you. Thank you so much.
We're coming right back.